This is a blood sample taken from a pregnant woman to measure the amount of blood in her body, what we call PCV. Now, I get this question a lot. Doctor, why is Betsy so particular about PCV? Every time PCV, PCV, PCV. What is the importance of a good PCV to a pregnant woman? Or more importantly, how can a low PCV affect pregnancy? Are you ready? Because I'm going to answer your question. Oh yeah, let's go. Okay, so we are going to be looking at all the consequences of a low PCV on pregnancy. So we're discussing, if I hear anybody laugh at my writing, if I hear anybody say pim about this writing, consequences of a low PCV. How can a low PCV affect you? First of all, it can affect conception. Just in case you didn't know, if you're trying to get pregnant, one of the things that can reduce your chances of getting pregnant is if you have a low PCV. A low PCV can also result in pregnancy loss, and this can either take the form of a miscarriage, all right, in the early part of a pregnancy, or a stillbirth. Okay? It can also result in what we call IUGR. What is IUGR? Intrauterine growth restriction. This means that the baby is not growing well. Okay? So one of the reasons why a baby will not grow well is because the PCV is low. Okay? What of labor? A low PCV can result in prolonged labor. Prolonged labor. What are the consequences of prolonged labor? Consequences of prolonged labor, I'm sure you should know by now, fetal distress, okay? It can also result in brain damage to the baby. We don't want that. It can also result in fetal death. The baby might not make it, loss of life. Does prolonged labor only affect the baby? No. Prolonged labor can also affect the mother. How? Excess bleeding, what we call PPH. I'm sure you have heard of PPH. A low PCV can cause it. It can also cause rectovaginal fistula, vesicovaginal fistula, predispose the mother to infection. All right? But are you shaking your head? We are not yet done. A low PCV can also cause delay in recovery. It's one of the reasons why a woman can struggle to recover after birth. Are we done? Not yet. A low PCV can also cause difficulty, lactation, difficulty. So look at all the things, all the consequences that can occur as a result of going in with a low PCV, of carrying pregnancy with a low PCV and going in for childbirth. This is what you don't want to put yourself and your baby through, and that's why we insist that you should build your PCV to the optimal levels. We don't accept 30, we don't accept 31, we don't accept 29. No, those are not good PCV levels. One of the things that we teach in Birth Without Wahala is how to build your PCV to an optimal level so that you don't experience any of these things, not for you, not for baby. If you're not in Birth Without Wahala, at this point I have to ask, what are you doing with your pregnancy?